Okay, so this is the base, the top part. This is the apex, the pointy part at the bottom. Next we have the left side, which is over here, and the right side, which is over here. Next we have ventral surface. So ventral. This is ventral in the front, and dorsal is in the back. Next, atrioventricular sulcus. So these little bags on top are called atrium. So this is ventricle, this is atrium. So in between this little gap right here is the atrioventricular surface. One there, and then there's one right here too. Next, we have the anterior interventricular sulcus. That's this one right here, the line that's going through the middle. Can you make that bigger for me?
Yeah.
Thanks. All right, so pericardiums, you have two of them. Both of them would be covering the heart, so you won't see them, and that's literally what you would say to me during the test, is that pericardiums are these covers for the heart. Okay, so next we have the three layers. If you take a look on the inside, what you see is that there's the muscle layer that's in the middle, and then the outside would be the epicardium, and the inside shiny part is the endocardium. Okay, next we have these little strings. Those little strings are called chordae tendineae, and the little muscles that hold on to them down at the bottom, those are papillary muscles. Next, interventricular septum. That is this dividing part right here. It separates both this ventricle and this ventricle, so basically the meaty part in between. Next, right coronary artery. That's where we're at. So, all the blood vessels kind of go along inside the sulcuses. So this is going towards the right, and you're not going to see it because it's all covered in fat, but all you had to do is basically point to the sulcus, and you're good to go on that one. Next is left anterior descending artery. So there's a blood vessel that's going along this side here and going down, and then eventually there's another one that comes down here, which is the marginal. Can't even think right now. So simply put, if you point to this, going along this side, it's point to this side, it's going to be the right marginal, and if you point to this side, it's going to be the left marginal, and I'm cool with that, because you're not really going to see them. But let's talk about the circumflex. Basically going left around underneath in this sulcus, that's going to be the left circumflex. And then left marginal, like I already mentioned. And then coming around the back, basically blood is entering back into the heart over into this atrium. So you have small, and then greater, and then sinus. So basically as long as you go from left, or from this side through the sulcus to where the atrium is, you're right. Small, greater, and then sinus. All right, scroll all the way up. Okay, so blood flow. This is the one that you definitely should know. For starters, you have a blood vessel that's going to be going into this atrium. On a lot of these hearts, it's busted, but here you can see this little hole. So that is going to be the superior vena cava and inferior vena cava. Again, this is a sheep, so it's not going to be up and down. It's going to be kind of like coming in from the side. Anyway, so inferior, superior vena cava. Scroll down, please. So inside here is the atrium. So this is called the atria. So inside here, atrium. And then the blood goes through this valve right here. That is the tricuspid. Potentially one of the things that is going to be worked on tomorrow in the surgery. So from this little cavity to this cavity, there's a valve. So atrium to ventricle. So this is now the right ventricle. All right, open space. But eventually we're gonna get to pulmonary semilunar valve. So as it leads, going up through here, there's a little valve. You can see these flaps right there. So that little flap prevents blood from going back. So this is going to be the pulmonary trunk, this little tube that comes out, and eventually out to the lungs, left and right lung. Coming back, we got left atrium. That's this bag at the top here. So blood vessels that are coming in are pulmonary veins. All right, so left atrium, scroll down please. And then, again, auricle is just going to be the flappy part above, or on the outside, but going inside is where it really matters. It passes this blood vessel. This is the bicuspid, also known as the mitral valve. It's most commonly worked on in surgeries that we've seen so far. So this is probably going to be the one that gets worked on. So it passes that blood vessel or that valve to get into this space called the left atrium. And then from there, it's going to go up through here. And there's this little valve right here. There you go, valve. That is going to be the semilunar valve, the aortic semilunar valve. And then this is the aorta, this big blood vessel at the top. And then eventually, blood is going to turn and it's going to be going through something called the aortic arch. And then out to the body and to the brain and everywhere else.